There were times when she told me, "Mom, I can't get in. They won't let me in. I'll sit in the emergency room for 12 hours, and then they'll just send me home."
Parents reached out to News 4 frustrated with the way ECMC handles addiction treatment. Good evening. They say patients shouldn't have to wait hours to be seen, and they should be held at the hospital longer after they do see a doctor.
News 4's Callan Gray went to the emergency department at ECMC today and has their response. Callan?
Don, Jackie, the emergency medical department tells me over the past few years, the number of patients they see for addiction and overdoses has skyrocketed, but they are working to adjust to the higher demand. Meanwhile, parents push for changes they say could save lives.
Michael Brady died from his addiction in March. His mother, Deborah, tells us it's too difficult right now to get into treatment, and it starts with the local hospitals, which treated her son after he overdosed in January.
The ambulance took him to ECMC, and he was released later that day. It should be mandatory that they're into treatment. No question about it, or leaving loved ones behind. My son left the son behind.
Catherine Gilmore's daughter, Ariel, also struggled with addiction.
She overdosed in the house, and we did have to call 911, although we were able to revive her before they got there, but they still took her down to ECMC.
She says they gave her daughter a cab ride home that day. Ariel eventually did get into ECMC's 28-day detox program, but died a few days after she was released, waiting to get into a halfway house. We went to ECMC to find out why those struggling with addiction aren't held longer.
There's no clear guidelines on how long a patient needs to be observed after they get Narcan to resuscitate them after an overdose. And we're actually in the middle of doing a study to try and figure out what is the appropriate time frame to watch patients.
Dr. Michael Manka says each patient who comes in is evaluated and, if stable, monitored for 4 hours. Then they are offered counseling from a substance abuse counselor and either admitted to the program there or set up with an appointment at an outpatient program within 24 or 48 hours.
The number of patients we see now coming in after unintentional overdoses has skyrocketed.
Just this month, more than 200 people have been seen in the emergency department for an overdose or for detox. There are only 18 detox beds.
The reality is there's just so many patients out there in the community that we can't admit every single patient who comes in. So we try our best, but we feel the frustration of families.
Now, Dr. Manka says when patients come into the ER, they do treat them as soon as they can, but the hospital is a level 1 trauma unit, so some days are busier than others, and it can be a longer wait. The hospital is getting ready for a $45 million expansion of the emergency department. Reporting in the newsroom, Callan Gray, News 4.